Welcome to this afternoon's media conference and live stream for the community at large to dial in. Thank you all for being here, and I wish everyone a happy Easter, a happy Passover, and Ramadan coming up in a few weeks. Unfortunately, as much as we'd all like to celebrate those wonderful events, we can still do that, but we have to do it from our homes. Not in groups and spatially separated or physically separated. So it makes it a difficult way to celebrate, but notwithstanding, the event is still on, and I wish you all a happy Easter and happy Passover. The City Council met this past week and passed a number of initiatives. The first one being a property tax installment waiver of penalties and interest for the payments after April the 30th, so you have 2 months, 60 days to waive the penalties and interest for a late payment. Obviously, that's to help the folks that are challenged with meeting their expenses right now due to loss of work or job or business. Hopefully, we hope that individuals that can pay their taxes will continue to do so. This city needs to have tax revenues coming in for us to maintain all of the services that we appreciate, which is obviously fire, police, paramedics, and keeping our city functional in every way possible. So for those that can, please do, and for those that can't, you have a 60-day waiver of penalty and interest, which is a de facto deferral, and a 30-day thereafter that in June, should you need it. That's another, the next pay period for taxes, and you'll have another 30 days to waive the penalties and interest then as well. So again, another 30 days forgiveness for a deferral. And I do want to clarify, this is not a tax forgiveness, this is a tax deferral. We cannot forgive taxes. We need that revenue coming in at some point during the year. And so we're hoping that this is a help and assist to those that need it. But for those that don't, please continue to pay your taxes so we can continue to function our city. Secondly, we also passed a bylaw that allows our municipal law enforcement and police to warn and fine individuals that are not adhering to the 2-meter or 6-foot separation, physical distancing wherever they are, or group gatherings for that matter. And so when we hear of occasions when people are doing a pickup game of basketball in some court in a park, or a pickup game of football or soccer or whatever it is, this is the wrong thing to do. We will have bylaw enforcement out looking for occasions where people are doing the wrong thing. And of course, the first order of business is to get people to comply, to do the right thing. But should they refuse to do so, the authorities have the ability to lay a $500 fine per event for individuals that are not adhering to the physical separation requirements. So thank you, Council, for that enhancement. And I know it frustrates some in our community. We don't want to do this, but we need everyone doing their part, and for those that refuse to, then significant fining will have to apply to get them to do what we need them to do, which is maintain physical separation and stop the spread of this virus. As you well know, the federal government made a number of announcements in the last few days. More importantly for local employment is 100% of the cost for student employment is being covered by the federal government for I believe a 3-month period, which obviously will have impact on the student employment opportunities that many would rely on for their future career goals or university goals. And so for those that can, you can get 100% subsidy to keep them on or hire them on. That might apply to the municipality as well. We'll have to have a look at that. And certainly some daunting, sobering predictions from the, or modeling, I should say, from the federal government today, which certainly gives one pause to kind of reflect and digest these. We've known all along these are very serious issues, but the length of time and predictions in terms of what time it might take, worst case scenario, best case scenario, neither one of them particularly good, but we can have impact on drawing ourselves towards the best case scenario as opposed to the worst case scenario. So what we're doing day to day, minute to minute, maintaining this physical separation and not spreading the virus is going to make a huge difference in terms of how many people are going to be affected by this and potentially how many people may die as a result. And so bear that in mind when you're looking at your Easter celebrations this week, hopefully with only the family in your home. And please do not gather in large groups, because the spread of this virus is still a very, very serious concern. And this is no time to let up, as Dr. Richardson previously indicated. I'm not going to go through the list of closures today. I'm going to turn it over to our good, hardworking manager of the Emergency Operations Center, Paul Johnson, to give us an overview of anything new and anything he wants to highlight for this upcoming weekend. And I believe we'll be back here on Monday with an update as well. So Monday, Holiday Monday, we will be here doing an EOC emergency health and update as in terms of what's new and changing in the ever-changing world that we're living in right now. So Paul Johnson, thank you.
Thank you very much, Mr. Mayor. You know, for the most part, from a municipal service perspective, we're now settling into delivering services in the way that we are at the moment. And I'm pleased to say that after making some adjustments to service, and I recognize some of that was a reduction in the level of service in this community, we've maintained stability now for a couple of weeks, and that's good news. Our staffing levels are down, and that's why some of the services have been adjusted, but they are maintaining their level of service. And so I think that was the goal, what we set out to do that. And that's things like our approach around garbage collection and composting, and the fact that we are not doing leaf and yard at the moment, although we're looking at how we might be able to do that as we now move through our spring months, but also our transit, which has remained stable as well. And although adjustments along the way, I'm very pleased with the way that our staff have pulled together to keep the city working as best as possible. Recognizing that we shouldn't be at work and trying to keep as many people out of our workspaces as is possible, following health advice, but keeping the city going. And so I want to start today by thanking all of my colleagues from across the city, those doing some of the essential services work in the frontline capacity, really taking on this virus, but then the many, many people also that are behind the scenes doing the other things that keep the city moving. So thank you very much for that. At our town hall last night, we did announce that we are opening up an additional shelter space in this community for homeless men, and it will be at the First Ontario Centre. I only say that because our goal is to get it up and operational over the weekend. So if people do see activity around First Ontario Centre and people moving in and out in First Ontario Centre, please don't call the police or bylaw and say, I think there's an event going on at First Ontario Centre. It's not. It's our folks setting up the emergency shelter. So we do know that there'll be a lot of activity as people are moving in and out, and we get that set up. And ultimately, some men in need of shelter will be moving into that centre as well. And again, a reminder, this is being done both to increase some capacity, but also to decrease the capacity in our existing men's shelter spaces so that they can exercise better physical distancing within those emergency shelters. So that is just a reminder to the community that will be happening over the weekend. One new piece that has been raised over the last week, and want to confirm our action on it. There are community agency donation bins around the community. One that has been highlighted is Diabetes Canada and their bins, which I think there's quite a number around the city. Our folks in Public Works will be going out and picking up some of the contents and actually removing those bins because the organizations don't have staff or volunteers to do that. We'll be storing those bins for the agencies, and at such time as they're able to use them again, we'll put them back out into the community. They are only attracting community dumping, and yes, I know some of it is dumping and some of it is probably meant as donations, but the reality is they can't take the donations, and so essentially it becomes a bit of a dumping ground for things. So for the health and safety of everyone involved, we're just going to remove the stuff and we're going to remove the bins. I continue to get remarks from our folks in the EOC that there may still be a bit of confusion around parks. Parks are open. Everything that's in them is closed. So please, if the weather permits this weekend, if there are picnic tables or a gazebo in your local park, you can't gather there. Even if you are distancing yourself, those facilities are closed. Any of the playgrounds, baseball diamonds, soccer pitches to play soccer on, not what we're expecting. But our parks remain open for people to walk through. or if the paths exist within them to cycle, roll, or wheel through as well. So we are asking everyone, of course, now with increased power to enforce, to make sure that they are adhering to the guidelines that have been provided by our health officials, and that is to maintain that 6 foot or 2 meter halo around yourself as much as is humanly possible at all times when you can. But of course, some people say, well, if I'm walking on a sidewalk and I walk by somebody, I may be within 6 feet. Is that a problem? It is such a low-risk activity, it's not a problem. Walk by somebody, I understand it might be a little less than 6 feet, but I think we've gone through that a few times to say it's okay. The last thing I will remind folks is thank you for your continued adherence to our transit rules around the use these days, and continue, if you need to, use the DARTS service if you are in a wheelchair, a scooter, or a CNIB card holder. You can use the DARTS service for bus stop to bus stop service. And I think that was a great way of helping out a situation that could have got difficult for people in wheelchairs, scooters, and who are CNIB card holders who may not have been able to access our traditional fleet of buses without a companion. So please take use of that if you need to. You need to call DARTS about that. You can book it up to 2 days ahead. And again, if you're using that for essential travel to appointments you already know of or to work, I encourage you to do that. Call them early and make sure that they get it in their reservation list, and we can make sure that you can move around this community to do your essential trips as much as is possible, and it is for those essential trips only. I can say that although there are not a lot of updates now from the EOC in terms of additional closures or work happening, our real work at the EOC now is responding to the virus as it moves through the community and impacts some of the things that happen in our community. And so that's why we are focused on our responses to the homeless population. We are working very closely with our health partners and public health partners around issues that may occur in what we call congregate settings. Could be retirement homes, could be long-term care facilities, residential care facilities. All of these become really the front line of work in this emergency for us now. We need to make sure that those organizations and those places can be sustained, and if there are outbreaks, and there are a few across our community, as you've heard from Dr. Richardson, that if there are additional supports that keep those facilities functional, that we're there to support. So a lot of work happening behind the scenes, making sure that those who need the care continue to get it. And if there are any challenges to the provision of that care, that we can quickly bring together the relevant partners and stabilize whatever we need to. So thanks very much for the chance to give that update, and I'll let Dr. Richardson take it from here.
Thanks very much, Paul. So just an update on the cases for today. We're at 206. That's 8 new cases since yesterday, confirmed cases as of noon today. There are, as always, more details on the website. Again, one of the numbers I like to highlight is the number of cases that have been resolved, and we're at almost 50% of cases. We have 90 cases now that have resolved, which is good news. And again, for most people, this is like a bad cold. Unfortunately, it's not for those that we're really trying to protect, a lot of them in those settings that Paul just talked about, people who are over the age of 65 or 70, people who have underlying medical conditions, and of course those who are most vulnerable because of perhaps their housing conditions or other things that make them quite vulnerable to diseases such as this. We do have now 6 deaths in total. One new one that I spoke about at the end of the day yesterday when we were doing the town hall. That latest death is an 88-year-old woman who had underlying risk factors as well. This was a case of community spread, and her symptoms began on April 6th, and she did pass away in hospital after a brief stay in the ICU. There are no other deaths that we're aware of at this point, and I've already talked a few times now about the fact that mostly what we're seeing is spread through contacts and cases, and spread through the community. You may have heard yesterday from Premier Ford about the increased testing capacity and the desire to look at doing more testing, and we think that's a good thing. We think that's a very important part of the control measures and strategy. And so if you have questions about testing, we're looking at how we can contribute to getting those numbers up, and you're welcome to call our public health hotline. if you have questions about that. We do still have the assessment centers running, and we're going to be working to look at how, in particular in relation to those vulnerable groups, again, that Paul talked about, and in long-term care, and with our healthcare workers and our frontline emergency responders, how we can help to make sure they're getting the testing they need. We do still have 4 outbreaks that are ongoing. We have not had any new ones: Heritage Green, Cardinal Retirement Residence, and Wentworth Lodge, and all of them are doing yeoman's work to make sure that they keep that virus as contained as possible. And so it's good news. They haven't had any changes in the number of cases or deaths in the last 48 hours or so, I think we're at now. Around St. Joseph's Healthcare Hamilton, where we know we had an outbreak in the special care nursery when 3 healthcare providers tested negative, as I mentioned last night in the public town hall. All contact tracing is now complete in determining what babies had direct contact. They have all been tested as well, and all of those results have come back negative, which I'm sure their family is absolutely thrilled about, along with all the staff members at St. Joe's. So we'll continue to monitor that situation closely, along with, of course, all the healthcare professionals at St. Joe's. Just again, to talk about this holiday weekend, such an important weekend, such a difficult weekend to do in a different way than most of us are used to doing, you know, coming together with family, going to our places of worship to celebrate all that this weekend and the coming weeks mean. It is, of course, has been talked about, imperative that we continue to practice physical distancing, that we don't come together outside of our own households. But there are so many ways that we can come together in other ways, virtually, and it's so important that we do. It's important for our mental health, it's important for our relationships, it's important for our vulnerable family, friends, or neighbors to know that they have somebody who wants to reach out to them and connect with them. It's also important that we do get a little bit of exercise, so please do, when you find the opportunity this weekend, get out in the yard, play some ball, you know, go for a walk around your neighborhood, but stay close to home and maintain that physical distancing. It's so important that you don't risk your own health or the health of a loved one or another person in your community while you're doing that. Just before I pass it over to the chief to Gert across the way, I just want to shout out to all of our public health staff. We've been at this work now for coming on 3 months within public health services, and we have a fantastic team of public health professionals who are directly responding to this emergency, and I couldn't be prouder of the great work that each and every one of them is doing. They are working around the clock. We are here 7 days a week, 24 hours a day. No news, I know, for the police across the way, but it is different for our staff. Many of our staff, you know, a few of them are on call all the time in any case, but now we have more of them working long hours, and they're taking time away from their families. And in many cases, they are actually putting themselves at risk and their health at risk in order to keep everybody else safe. We have 220 public health employees who are working on every element of this pandemic, including our epidemiology staff who do the kinds of numbers and whiz stuff that you see have come out lately, our hotline staff who are answering the calls and emails from our community, our management team who looks to see how we can do case management and contact management and work with the assessment centers. It's about 50% of our workforce that's working on this. And then we have many more public health staff who are continuing on with essential services. We sometimes forget there are diseases other than COVID that are still going on out there in the community and causing outbreaks in some places. We're following up on food premises that thankfully are still, you know, providing some food service for our community, working with adults and children who have mental illness or addictions issues, and of course, you know, very concerned that we continue to support people in their mental health and wellness. And of course, following up with new families like those ones from the special care nursery as they adopt into their family a new member in ways that I'm sure, in an environment that I'm sure they had no idea would be happening when they first knew that this person was coming into their lives. So a big shout out to all of them and to our community as well as we continue on with this. Over to you, Chief.
Thanks, Doctor, and I'll do a segue into what you just said. My thanks as a frontline responder to your frontline responders, being the nurses and doctors who continue this work, public health. We rely on them to keep us safe, and of course we're relying on their recommendations for how we keep both our own members healthy, but also the clients that we interact with on a daily basis. So certainly kudos, and you've been managing the emergency a little longer than we have. because you've looked at the outbreak, what is happening worldwide. And I also want to give kudos to Dr. Richardson for implementation of the incident management system about 10 years ago with my predecessor, Chief DeCare. So you need to know from a public perspective that we have done lots of training on emergency management. This is a little different because it's I'll call it a slow-moving emergency, but it certainly has the same implications as any other emergency for life and death implications. So we do have a strategy, a framework in place. We have worked together both with real events and with practice events through the course of time. So this has been about 10 years using this system, and I think we're seeing the benefits of this. 3 people in this room besides myself are managing the bulk of this, as it should be, and just kudos to that as well. Before I get into the weekend and how it's going to work, you should know from our responses to calls that we continue with our staffing. We are responding to all the regular calls for service, and will continue to do so. As far as mental health is concerned, the one area we have seen uptake in is in our Coast hotline. So that's where you can't respond, but people are phoning in. So know that that's on a 24-hour basis. But our other 2 aspects of our person and crisis unit, the one being the mobile crisis rapid response team, which of course responds with a mental health worker and a frontline officer to life-threatening situations, either the person themselves or to others as a result of the actions of that person. And then of course we have a regular Coast where it is not life-threatening. Our members will respond in plain clothes. We will continue to respond. We're going to practice physical distancing and do the checks in terms of any COVID implications. All those services persist. And just to also build on Paul Johnson's response in terms of the homeless, as you know, for years we've been working with responses and our community partners for more novel approaches to how to do this work that don't criminalize behavior, that lead to alternate outcomes. And obviously from Paul's work, and he has done extensive work on shelter, homeless, men's accommodations, they are doing that work. We are working with them. And we still have our social navigator as well, which was, of course, to access services for people who might not know otherwise what to do. That work continues. So we actually have a full complement of officers. Some have been redeployed who might do work like school liaison work or divisional youth work. So they are on the front lines because we know there may be additional risks in terms of businesses that are closed but not necessarily have people in them. We remind people about crime prevention techniques, securing of premises, deadbolts, all those usual crime prevention things we do. I've mentioned previously a number of arrests we've made through owners monitoring their premises by video where they have it and have called us, leading to arrests. And of course, those arrests have an impact in terms of those who are contemplating doing criminal activity when there are maybe less people around. So we continue that work. It's quite important. In terms of this weekend, and we do know it's not the norm. I mean, we've heard that many times, and it is not. Under the provincial state of emergency declaration, events of more than 5 people are prohibited. And this does mean private social gatherings or religious celebrations for Easter, Passover. We've mentioned other celebrations, faith-based, coming up in future. Residents organizing or attending those gatherings of more than 5 people may be charged under the Emergency Management and Civil Protection Act, has a fine of $750. Obviously, what we're doing as primarily bylaw responses in the first instance, but policing when bylaw is not available, is to get compliance. Certainly the message has gone out. Most recently, you've had a bylaw enacted yesterday in terms of physical distancing. Again, keeping in mind why this is, it's not enforcement for its own sake. It's enforcement based to lead to better public safety, better public health. The liabilities could be a minor cold. It could be more disastrous than that. So we ask for compliance on that. One of the things you may want to do is reach out to your faith leader and see what options. We do know, for example, on James Street North, one of the ministers is hosting a virtual conference. We do understand under these times, whether it's mental health or whether it's spirituality, they both remain very important. So if you can spend time with those people virtually, please do so. Please do not collect in private residences. They are not exempt. And again, this will be bylaw that responds in the first instance. The phone number for that call is 546-CITY, and that's 546-2489. So one alphabetically, the other numerically, same number, 905-546-2489. And we've had changes. We understand the statutes have changed. Again, this is happening not just provincially and municipally, but really, in my experience, one of the first times we've seen things happen at a global level. So this is a change. I think it's an opportunity to see what changes we can do, prioritization of things, and we will continue to do that work. Our primary focus as a police service remains on public safety, and that includes things like, and I hate to have to say it, speeding. We have seen some high rates of speed on the roads as they're vacant. It is not permitted, and we will be out there enforcing and have enforced and will continue to enforce, and all the other situations. We understand that risks for a person in difficult family situations, we will investigate domestics as we always have, sexual assaults, child abuse offenses. We are not suspending any of those activities in terms of our response and then the follow-up on that. Where we've been able to for civilian staffing and some sworn, we have allowed persons to work from home. But again, we are meeting our staffing numbers on the street. I can't say enough, although I did already for the public health workers and nurses and doctors, and I don't underestimate that because we rely on that. But our members have kept their morale up. They are continuing to do their work in a very optimistic, engaged fashion. I can't be prouder of their work. And from a public perspective, we all need to work towards that effort to support the goals identified by public health. And keeping in mind, this is a public health emergency. So where we get compliance, that's what we want. So the best you can do is help us out towards the common goal.
Thank you, Chief, and we do appreciate all of our frontline workers, Hamilton Fire, paramedics, police, of course, and of course the great work of public health, nurses, doctors, and public works. A lot of the folks that are still out there collecting the garbage and maintaining the roads and fixing the water main breaks as they happen, all of that is still continuing, and in the services of the city are still online, even though there are people not in the building per se. All of the departments are functional, and folks are working from home, and all of your counselors are working as well with their usual administrative assistants at the same numbers and the same email addresses you would be familiar with. So feel free to contact anyone that if you need service or help or assistance, please go there. And of course, the hamilton.ca/coronavirus website, I'm being informed by many in the community, complimented on the ease of access on that website for a lot of the services that are now required, especially those announcements from the federal government and how to connect to the application processes are all in there. So if you want a one-stop shop for information, the Hamilton website is a great place to go to get information, not only on the COVID-19, but all the other programs that are out there to help assist individuals and businesses in our community. So thank you for going there and using those services. And of course, the hotline and the COVID-19 public health website is up and running as well if you need more information there. We continue to ask for donations of personal protective equipment, things like surgical masks, N95 masks, impervious gowns, gloves, face shields, hand sanitizers, and swabs. If you have any, feel free to get a hold of us at ppe@hamilton.ca, and we will come by and arrange to have it picked up. We want to thank Nations Fresh Foods for a donation of 10,000 pieces of protective masks earlier this week. A great contribution to our first responders, healthcare workers, long-term care workers. Comes in very handy. Anyone else that has any of that type of material, please let us know. As well, Labor's International Union of North America donated 100,000 pieces of protective equipment as well in the Greater Toronto Hamilton area. They are to be lauded for that. And I know a lot of work is going on to discover and find and purchase and acquire more personal protective equipment as needed going forward. So it seems to be a critical issue, and the more of it we can get into our hands, the better. So if you're not using it, please send it our way. I want to thank some of the good news stories out there. Our Swiss Chalet restaurant on Queenston Road, providing free meals for bus drivers and grocery store workers that are still working out there every day to provide groceries for you and to provide transportation for those that need the transit system. Obviously standing at some risk in the broader community. They're not isolating at home all the time. They're still at work. And so gratitude from Swiss Chalet to them for the hard work they're doing is a free dinner. And the Waterdown Collision is prepared to go anywhere in Flamborough to pick up non-perishable food donations, and they'll bring it to the local food bank. So if you get a hold of claims at waterdowncollision.com, they will arrange to pick up whatever you might have and get it to the food banks as soon as possible. The need is great, and your contributions are welcome. As well, a reminder that we love our sign language interpreters, American Sign Language interpreters, Rosalie Visers and Georgia Whalen. We thank them so very much for the work they do to provide translation for the deaf. And a reminder as well that there is help out there for individuals that are having mental health issues and for kids that might have domestic issues or mental health issues. So Chief mentioned COAST. You can call them at 905-972-8338. For those that are having in crisis challenges, get a hold of that number or call that number, and there will be people on the other end of the line that can help you. And for kids, help phone line has been and continues to be available 24/7. You can text at 686868 or at 1-800-668-6868. And there is help on the other end of the line for you as well. And we know that there are many children either obviously concerned, but possibly in distress or having domestic challenges. There's a number you can call that can help you out. And beyond that, we've asked the churches in the city on Wednesdays and on Sundays at 6 p.m. to ring the church bells in support of all of our frontline healthcare workers, first responders, and everyone keeping our city cared for, safe, and fed during this pandemic. And I did note that on Wednesday they chimed in, and we hope that all churches in the community will do that in honor of all of those great people that are keeping us healthy and well and looking after us both from a food and safety and security perspective. Beyond that, we wish you all a great Easter weekend, as much as you can make it great, but continue to maintain that physical separation as much as you can. And do get outside to get some air. The sun's going to shine a little bit. Do take a walk through the park or around your neighborhood. Don't go for a drive to take a hike on one of the trails and meet up with family members. That's the wrong thing to do. This is not the time, so take a rain check on that. And at the same time, still find a way of celebrating Easter and or Passover with the digital means that we have available to us. Many churches are accessing that, and I'm sure that there will be a Christian Mass on Sunday as well on television, as it usually is, so you can dial into that as well. Thank you all for your efforts going forward in the broader community. By and large, everybody's doing great under very difficult, trying circumstances, and unfortunately, it's not going to be over soon, so we need to stay determined and focused, and I think it doubles our resolve to get us through this process, even though some of the news in the short term is a little daunting. At the same time, the choice we have is we can actually make it better by doing what we're doing now, or we can make it infinitely worse for a lot of people and possibly more death for a lot of people if we stop doing what we're doing currently and if we don't continue doing that for the next possibly few months. And so thank you for all that effort. The vast majority of you are doing what you're asked to do, and I know that policing and MLE, municipal law enforcement, will be out responding to either complaints or directly out and about looking for opportunities, that's not an opportunity, looking for occasions where people are not doing what they're asked to do, which is to stay home and maintain that physical separation. So thank you all, and I'll turn it over to Jazz for any media questions at this point.
Thank you, Mr. Mayor. We do have a number of media partners on the phone. I'll just remind everybody one question and one follow-up, and just please keep yourself on mute when it's not your turn. We'll start with Jennifer from CBC Hamilton. Go ahead, Jennifer.
Hi, everyone. Thanks so much for taking my question today. My first question is for Paul. For the First Ontario Centre, how many staff are we thinking are going to operate that or needed to operate that? And where are these staff coming from?
So the exact numbers that will operate it, I don't know. The Good Shepherd Centers is managing it, so they will staff it up appropriately as they would see fit for a 24/7 operation of an emergency shelter. So the exact numbers, it changes. I mean, overnight there may be a few less than during the day, but food, all the things that you would see in an emergency shelter are going to be done. And I'm so appreciative for the Good Shepherd Centers of stepping up and saying, yes, we can staff this and essentially add this to our stable of emergency shelters already in the community.
And then just another question for you, Paul. Is this costing the city anything? And if so, what is that price tag?
So yes, we are fully funding the shelter. The price tag on it will depend on how long it's in operation. So I can't give you a precise price tag, but all of the costs of the operation of this center will be funded as we do with other emergency shelters at that same level. So yes, a significant cost is going into homelessness. The good news is that we've seen about $10 million so far flow in, both provincially and federally, funds that can be used towards temporary shelter and homeless populations. But as I think I mentioned a couple days ago, with this new shelter, I think we're going to be about $2.5 million more a month invested into homelessness and vulnerable populations than we would normally spend, and none of that investment has changed that we would normally do. But right now, quite frankly, it's keeping those populations safe. They are at risk, as Dr. Richardson said, just by some of the other health issues they have. And the other piece is that they have nowhere to go in terms of isolating themselves and staying inside. We need to provide that, and we'll do whatever it takes to make sure that happens as safely as it possibly can.
Next question goes to Samantha Craigs from CBC. Go ahead, Samantha.
Hi there. Thanks for taking my question. My question to Mr. Johnson, you mentioned the donation bins. Are we talking about clothing bins, and how many are we talking about that the city's going to collect?
So I know we're into around 20 at least. There may be a few more here, and these are where items of clothing, but recently we've seen some furnishings and other things arriving at these spots as well. So these are the typical places where furnishings or small items would be placed, but I think they have been attracting some more of the dump type variety of stuff coming, and other people that are just leaving the donations there, perhaps expecting they are being picked up, but these organizations don't have the staff or volunteers to do that. So we'll just remove this as any confusion that donations are still being accepted, because they aren't, and also remove it as a potential location for some illegal dumping.
I also wanted to ask Dr. Richardson. The CBC has done a report today, Mike Crawley did, showing that testing in Ontario has actually slowed down, or it's not happening as often as it did, maybe a week or two ago. Have we slowed down our testing here in Hamilton as well?
Thanks very much. In terms of it intentionally being slowed, there was a time period when the tests were, the swabs weren't available and the reagents weren't available, so there was some pulling back in terms of testing and restricting it to the highest needs groups. And so as we're moving forward, we're looking to see how we can expand that testing. So we do know that testing numbers have been down. We are looking to get those back up. We're looking at various ways that we can do that.
Thank you.
Next question goes to Dale from CHCH. Dale, go ahead. Are you there, Dale? Okay, we'll skip ahead. Joanna from the Hamilton Spectator, you're next. Go ahead.
Hi, thanks so much for taking my question. This is for whoever would like to answer it. As Mayor Eisenberg talked about a little bit earlier, the federal projections have come out today, and the Prime Minister said that normality, as we know before, will not come on until there's a vaccine, which could be 12 to 18 months away. So, I think this is going to be very startling information for people. So I was looking to see if you could talk about that, or your reaction to that, or some thoughts for the public on that.
we may have a couple of answers to this. I'll start by saying that absolutely one of the things that we're turning our attention to in the EOC is what does the future look like in terms of some return to normalcy. I don't think the Prime Minister, if I listened correctly, was suggesting that this more stringent locking down of services and activities in communities would continue for that period of time. But I think there's going to have to be a lot of discussions about exactly what does delivering service in community centers, in schools, in some of these other facilities that we have, what does it look like? And even in commercial endeavors, what does it look like as we move out of it? So I would say that no one has the answer. I think the timeframes that people are suggesting is this isn't a light on, light off situation, and that's become very obvious to us. So we're starting to turn our attention operationally to what would things look like at the city if we were to be trying to have some increased social distancing as a more permanent way of doing business as opposed to the old ways that we were doing business. So I'm not sure whether Elizabeth and the mayor want to chime in as well.
You know, I think as we've been looking at the scenario, we've been thinking all the way through in terms of where does this go from here, and I think, you know, I'm not surprised at all to hear that those numbers are startling, and the implications of them are things that weigh heavily on all of us in terms of what it means for life as we go forward. You know, I think when you look at some of the more detailed notes that were distributed about some of the things that are most effective in terms of reducing spread, looking at that, the kind of testing that we're talking about, and now that we have more access to testing, to get the testing up, you know, and to encourage people to come forward for testing. I just remind us all again that, you know, for the people who are getting tested, the main benefit of them doing that is for the rest of us. And so we really have to thank them and be glad for them and support them when they're coming forward so that they can then take the appropriate control measures, and the people around them take those measures as well. And so those are really important. The physical distancing is very important. And I think, you know, as we go forward, what we're going to have to see is how much we can let up and how much we need to continue at the level of intensity that we're doing now. And that's going to take some time as we go through this to learn, and that'll be hard. That'll be hard for people to cope with. You know, dealing with uncertainty is perhaps one of the most difficult things we all have challenges with, and then on top of that, things that we can't control. And unfortunately, all we can control is our own decisions and what it is that we choose to focus on as we're going through this time. Controlling exactly how these measures are going to work and how this virus is going to behave isn't one of those. So that piece about, you know, finding ways that you can have hope in your own life, that you can find things to look forward to. My son, who's had some significant medical issues and who's had to do this at times for himself, that's one of his primary ways that he copes in getting through the months that he's been at this, long before COVID was ever around. So I think it's really good advice for us, and the sort of support and being in it together, finding ways we can support each other are absolutely key.
So as I mentioned earlier, I mean, I think we're all in the kind of space of processing, you know, what we've heard today in kind of stark terms. I think we've all realized at some point or another that in the absence of wiping out this virus, which I don't think is necessarily what can be done, this virus is going to exist. And until such time as there is a vaccine, I think we're going to have a difficult time kind of getting back to the normal that we had prior to this. So for me, the reality is that certainly for the next foreseeable months, we're in this kind of environment. And as daunting as it is, I think the options that we have are not particularly good. So if we let up on that, then we know, and I think that, you know, that's certainly the modeling tells us that many more people are going to get sick and many more people are going to die. And so as the medical officer of health said, these projections are highly sensitive. In other words, we can have impact on them. So what we do on a day-to-day basis will have impact on the amount of people that get sick and the amount of people that may die in the future. The expectation that more people will die is a very sad reality. I think that's not a message that anyone wants to hear. What I want to be sure to do is to make sure that we minimize that as much as humanly possible. That's our mission. That's our collective mission. That's our collective mission not only here, but around the world. This is not just a Hamilton issue. This is not just an Ontario or Canada issue. This is now a global issue. and we're all in the same boat. And we're going to have to rely on our federal and provincial governments to continue to ensure that they're shoring up what's left of the economy and the employment opportunities and resources going to individuals out there so that we can maintain some semblance of economy so that when this is all over, that we can begin not from a deep hole, but from some semblance that there is an economy left for us to build on. And so I'm still processing. I think, you hear those numbers today, and I think we've all had it in the back of our minds that the vaccine is the answer. And when you hear the answer on when that vaccine might be available, as hopeful as we all might be, that it's potentially, a half a year or a year away. And so that really kind of puts this into context, and it certainly puts into to people's minds the kind of time frame that we need to be thinking about as we keep working towards minimizing death and minimizing the amount of people that are infected by this virus.
Thank you very much. My second question is about the directive that came out today from the province about masks being worn in long-term care homes by all staff and essential visitors. And I know the city has had a low PPE supply and has also been helping out long-term care centers, plus you have two of your own. So can you talk about, do we have the PPE in Hamilton for that? Where are you at with PPE and what will this mean for you?
PPE is a challenge. There's no other way of putting it. For now, we have PPE. For how much longer, no one can say for sure. We keep hearing that supplies are on the way. It was good to hear that there are some that have arrived provincially. And just so we're clear, obviously the city will provide some to our two long-term care facilities. Long-term care facilities, in the broader picture, all of the long-term care facilities, they do have their channels that they both procure their own PPE, and they have access to provincial stockpiles through their own channel. So the city does not provide it to all long-term care facilities, although occasionally we have to step in emergencies with retirement homes. So I would say that I'm worried that I hear a lot about what's coming. We haven't seen it in terms of our stockpiles. Are we out yet? No. But are we ensuring that we are conserving the PPE we're using? Yes. So we are talking constantly with our staff about PPE conservation. And that is different than saying to them they can't have it. So sometimes you'll say, well, that comes across as you don't want them to use it. No, we want them to use it in the most conservative way they can, because we must stretch on this supply that we have now, because there has been no one that is guaranteeing that the supplies will come in order to meet this. So obviously the directive increases what we call the burn rate, the usage rate. That means we have a supply that will end quicker, and we continue to source whatever we can. We continue to ask for the public's help in that. And the other thing I would say is that, just so we're clear around this, these are not N95 masks that we're using on a regular basis. Those are still, for our long-term care facilities, in good supply because they are rarely used in a long-term care setting. So N95s are not our issue. Surgical masks, procedural masks, those are the kinds of things that we're more concerned about from the long-term care perspective.
If I might just add one thing, our members have been using North half-mask respirators for about 10 years now. So it's fundamentally a neoprene mask with two filters on the front. So it will look a little different in terms of the response. It does meet the requirements, same as an N95. Our advantage in terms of supply and demand is that those filters can actually last a couple of months. Requires disinfectant of the neoprene. So you may see our frontline responders look a little different. Don't be alarmed if you see kind of the two cones in the neoprene mask. It's actually, in our view, their personal issue. They last longer and will actually help conserve for other areas that need the N95 masks. So I just don't want you to be alarmed that it's some other higher threat. It's just a different look.
I think we have Dale back on the line from CHCH. Dale, if you're there, you can go ahead.
Am I on? Is the audio working now?
It is. Go ahead.
Oh, perfect. So thanks for taking my question. This is for Dr. Richardson. We've gotten worst case, best case modeling from the nationally and provincially. Is there any modeling for Hamilton specifically? And if so, what does it say?
So it's been interesting for us with modeling because we've been working on it, and then each of the other levels of government comes out with their latest bit of modeling, and we try to understand it so we can adapt ours and go forward. So yes, we've been working on it. It does similar pieces in terms of looking at best and worst case scenarios. And we'll look at it and understand the federal government's use of different ways of doing it over the next several days, and hopefully get to have something more in the coming week or so. I think the most important point, though, about the modeling is that it all basically says these similar things, that what we're doing right now is all so very important to changing the outcome. Ultimately, these models are just projections. They're just ideas. They're just mathematical equations without reducing the importance of the work that our modelers do. They're just equations that look to predict the future. And we all have that future actually in our hands in terms of what we're doing each and every day to prevent the spread of this virus. And I think, you know, the more that we do of that, that is what those models show. The more that we do of those things, the better an outcome we can have for all of us, and especially for those who are at greatest risk. So ultimately, when we look at those models, we know that we're already doing everything we can with the hospital sector and the ICUs to make ready for people who become seriously ill. We know that we are working very hard across those in the communities to look at other ways that we can support people and have the conversations that need to be had about what our choices are were we to become very ill. And we need to keep on focusing on this piece about physical distancing, about staying safe, about washing our hands, about not touching our faces, especially as we come into allergy season, and all of those things that are so very important.
And methods that
Sorry, Dale, we're losing you there.
can you hear me? Hello?
Yeah, go ahead.
So this is for Paul. What are the conservation methods for the city in terms of PPE?
So first and foremost, we use it in appropriate settings, and we use the appropriate materials in the appropriate settings. So we're following directives, but we have been following those along, so that's helped us conserve. And the second piece is that we do a lot of training around the proper use of those, and not discarding PPE until it's necessary to do so. And so this isn't. So we do that work with our staff every day, and they're very good at it, and they are going through things appropriately, and that's what's important. But these directives, once implemented, we have a lot of staff that work in our long-term care facilities, R2, and then you have about 4,000 beds in long-term care facilities in Hamilton. So you can imagine the usage that's going to happen just in the long-term care sector. And I think it's important to recognize that we also have hospitals that are going through high levels of PPE in this community, and then additional people that are out there using this material as well. So our conservation measures come down to training. I would say that is the key word for it. We train so that we don't waste in any way, and that's how we're doing our conservation right now.
Thanks. Next question goes to Tevye from the Hamilton Spectator. Tevye, go ahead.
Thanks very much. Paul, I was wondering if you could go into a little more detail about the staffing challenges that social service agencies are having. Why are they having these challenges? I'm thinking with respect to providing the human resources for the shelters. What's going on there, and what's being done to try and alleviate that?
So the good news is that the organizations are fairly stable at the moment. They are dealing with staff who are away for a variety of reasons, including staff that are isolating, and they've actually been able to up staff to ensure that they can cover the emergency shelter that's opening a First Ontario Centre, and we also have Mission Services providing some support to some of our hotel spaces. So right now things are stable, and recruitment is continuing. So the other piece that's going on, of course, is that organizations are recognizing they need to bring people into this area, and you know, you hate to see silver linings in negative situations, but there are people that are out of work right now, and some are wishing to get into work and taking these opportunities. So recruitment continues in organizations. Our check-ins were, how are they doing? Initially, there was a dip, and there was some concern about whether that would get stabilized and work its way through, and I'm pleased to say that it is. So sitting here today on April the 9th, I have a good confidence that our services are where they need to be, and better than that, that the organizations are continuing to bring staff into their centers so that they recognize that there may be other staff that get sick or have to be off. And I think that we're doing the right things in the community to make that work well.
Great, thanks. My second question is about how many people are staying in hotel rooms. What's the challenge in getting people into hotel rooms? And finally, do we still have one person at the Bonetto Isolation Center?
So I'll answer it reverse order. Yes, we still have one person at the isolation shelter. They're coming into the end of 2 weeks, and then we'll be working with health professionals to understand what happens at the end of that isolation period and whatever testing is required in order to clear that individual to move on. I'm not sure where that moving on is, so I won't address that. But we still have one person there and coming to the end of a couple of weeks stint there. In terms of hotels, at last count, I think we had 50 individuals or families in hotel rooms. And that is both to relieve some pressure sometimes on shelters, particularly the family shelter and women's shelters. And then we do have some of those rooms available if people need to be separated as we wait test results if they're showing symptoms of COVID-19. So about 50, we have many more hotel rooms available there. I wouldn't say there's any challenges in getting people into hotel rooms. It's an option that we use. Staffing, of course, is not at the same level of support that we would see in a shelter, so we always make sure that we're matching people up with their environment well. The folks who need more support, we'll keep them where there are people that can provide that support. So I think right now, the movement in and out of the system is working out okay, and we expect to see that there will be an increased pressure on hotel rooms, both as we continue to do testing and may find maybe waiting or seeing symptomatic folks and waiting for testing results, but also as the shelter system continues to take more people in. Where we have a little bit of a challenge right now is we're not able to do as much work in helping people to find permanent affordable housing. It's difficult right now to have all of that work happen when our first priority is, of course, stabilizing people who are homeless. So there's a little less movement through the centers into permanent housing. And so that's causing us to have a few more people in the shelter system than we might normally have. We've also redeployed some staff who might have been, we haven't as a city, but agencies have, who may have been doing some of that outreach work or housing placement work to shore up their operations. So that's a little bit of why it's nice to have those hotel rooms.
Great, thank you.
Next question goes to Matthew from the Hamilton Spectator. Matthew, go ahead. Are you there, Matt? Okay, I'll just check to see if there's anybody else on the line that we didn't get to yet. Hearing nobody, I'll pass it back to you, Mr. Mayor.
Well, thank you. I don't think there's much more to add other than gratitude to the police chief and Paul Johnson and their team and public health Dr. Elizabeth, all of them, and working double time to get all the issues looked after in our community to make our city functional and to keep our city safe and secure. And so, now the message to you is this is something that's still very much in your hands, public at large. Citizens of Hamilton, it's your challenge now to continue doing what we're doing to maintain that physical separation and stay home as much as possible, wash your hands, all the things that we've been asking to do. It is time to continue that, not time to let up, and start thinking about how that's going to impact you over the next few months. I think we're all processing at this point and fully understand the angst and anxiety out there. Many people in our community are financially challenged at the moment, and I'm hoping that they get access to the federal and provincial funds as soon as humanly possible, so that they at least can have some measure of stability in their lives. And many others in our community, especially the marginalized, the homeless, and those that are struggling with food security and others, are particularly challenged at this time. And I think we're spending an inordinate amount of time, not an inordinate, the appropriate amount of time, to ensure that we're providing safety and security for those individuals in our community as well. So everyone's doing their part. All we ask you is to do your part, which is to maintain that physical separation, wash your hands, stay home as much as possible, look after one another, be kind to one another, be patient with all of the workers out there that are keeping our city functional. Bus drivers, we don't need to give them a hard time. They're out there every day manning the transit system so people can get to work and keep the city functional. The grocery store clerks are braving the front lines. The pharmacy store clerks are out there every day making sure that the things that you need to maintain your everyday life is available to you on an ongoing basis. So be courteous to them, be kind to them, be helpful to your neighbors, and help your family in whatever way you can, financially or otherwise. We can all get through this if we help one another. And have unity of purpose here. And the unity of purpose is we want to defeat this coronavirus as soon as possible. It is going to take some time, and you are instrumental in making sure that we do it as quickly as possible. Thank you all, and have a great weekend. Enjoy yourselves, be safe, enjoy your families, and we will talk to you on Monday.